Okay, so this one is going to be congenital adrenal hyperplasia. So what is it? It's a genetic disorder where the adrenal glands don't make enough cortisol and aldosterone. So the most common type is called 21 hydroxylase deficiency. So basically, it blocks the production of cortisol, so it'll increase the ACTH, which will also increase the production of androgens, which is male characteristics. So what happens here is it increases more male of the characteristics because of not enough cortisol, not enough aldosterone. So cause is just a genetic mutation. You're born with it. You can do the diagnostic testing during the metabolic screening for newborns. So this is whenever you'll discover it. So let me make this a little bit more clear. So it's a genetic disorder where the adrenal glands don't make enough cortisol and don't make enough aldosterone. So with low cortisol, that increases ACTH. With the increase of ACTH, you're going to have an increased production of androgens. Androgens are male characteristics. So in the male, since it's an increase of male characteristics, remember, these are babies. These are young kids. They're going to have an enlarged penis. It'll be adult size by the time they're 2 to 3 years old. And for a female, this is where you'll see most of the questions, I believe. They're going to have secondary male sex characteristics. So they're going to have ambiguous genitalia. So it's going to look pretty similar. The clitoris is going to be really swollen and really big, and it might look kind of like a penis. So the labia is going to be rugated. It's going to be all sticking out, and it'll be very swollen. And then the labia folds will be fused together. So they'll be kind of like stuck together almost. The internal organs are normal, but it does lower the fertility. So it looks different from the outside, but on the inside, the ovaries, the uterus, all of that will be the same. So, signs and symptoms will be premature adrenarche. So, they'll have, male characteristics sooner. Pubic hair, advanced bone age, short stature, hirsutism, which is where women have facial hair, acne. And then you also have something called the salt wasting crisis. So, everything's low, basically. You're going to have hyponatremia, hypotension, hypoglycemia. But remember, when you have low sodium, potassium goes up. So hyperkalemia. So therapeutic management. The goal is to stop excessive adrenal secretion of androgens. So you can have a glucocorticoid or a steroid. The ones that you're going to use are the hydrocortisone and fludrocortisone. The infants may need sodium supplements because of this saltwater crisis or surgery. Now, the surgery you can get done immediately, but you're always gonna have to keep coming back whenever your body changes to do more surgery, like for the girls, for instance, or you can wait and do it later. So the nursing management, acute adrenal crisis. This is something that can happen. So signs and symptoms are vomit, dehydration, hyponatremia, hyperkalemia, hypotension. You're going to have tachycardia and shock. So you want to give them IV steroids, so the hydrocortisone or fludrocortisone, and give them aggressive fluid resuscitation with the D5 normal saline, the 50%. Then you want to look at their medication regimen. So cortisone can be given by mouth. If you underdose or overdose, they can have a short adult stature. You don't want that. It can also be given intramuscularly, so you want to teach the parent how to do that. You want to tell them to keep the extra intramuscular injection at home for emergencies, and you also want to tell them to rotate the site. You also want to support the family. So you can allow the family to ask questions, explore their feelings, immediate surgery, or delay treatment until the child is older. Kind of like I said, they can do the immediate surgery, or they can wait until the child's over. Because if you do the immediate surgery, you're always going to need it until they're done growing. And whenever you're talking to the child or to the parent, you want to keep everything gender neutral. So you're going to say your baby, their sex organs. You don't want to say your daughter, your son, because it could be a female, but their genitalia doesn't look the same. And then you want to say sex organs. You don't want to call it a penis or a vagina because their clitoris literally looks like a penis. And you want to make sure that you're very understanding. Being understanding, gender neutral, and understanding this immediate surgery thing, this is going to be all very important. They're definitely going to ask you about what management, so like the steroids. They're definitely going to talk about that. And they're definitely going to talk about the enlarged clitoris, the ambiguous genitalia. They're definitely going to ask about those things. And the internal organs are normal. They're normal. Pubic hair. Yeah, signs and symptoms. Because these are little kids. So these things are all going to happen when they shouldn't yet.